Good morning, colleagues, partners, friends. Thanks for joining us in what we hope will be an interesting debate on nutrition and incomes for addressing COVID-19 and beyond. Um, it's been a long journey, but we are happy that we can come to this forum to share the results of the assessments that we have commissioned. So on behalf of the partners, IFAD, PIPSO, CTA, thanks for joining us. Just a brief, our project covered 7 countries in the Pacific. Our goal is really was and strengthening the capacity of the individuals, organizations to mobilize financing and increase access to nutritious and healthy foods. We adopted a multi-stakeholder cross-sectoral approach, and we like to talk about our analyze, act, and advocate approach. Today's session really focuses on the nutrition component, and we have done several activities which have brought us to this point, and we are very pleased that we were able to build on some of the lessons learned to respond and provide some evidence on what is happening on the ground in terms of COVID. Our partner says that with respect to nutrition and income, our goal, the impact should be reduction of NCDs and increased income through food crops and fisheries value chain development. We will share a little bit more about that. Specifically, we worked with community-based organizations in terms of helping them to address nutrition and incomes at the level of the communities. And USP did conduct an assessment earlier in the project, and they've built on that assessment for the results that they will share with you, with us today. In addition to USP, and these are just some of the examples of the work that we did in the Pacific with our partners, with Ebon et al. in Marshall Islands. And one of the important issues is that it was driven by the communities and the community organizations where they wanted to place the emphasis. So in Tonga, it was about school nutrition and school gardens, and ensuring that the farmers and the schools had a closer relationship. In Solomon Islands, it was about the quality of the planting material and making sure that people had access to improved seeds, cuttings, etc. In Métis in Samoa, they needed to establish a nursery, and this would produce, they would provide them with nutritious plantings, cuttings that had been overlooked in the past. So this is just an example of some of the activities. But we didn't only focus on the community aspect, and you'll be hearing from Ateka and Irene about the Mycana app, which has proved very useful, especially under these circumstances. So some of the key messages in terms of as we go forward into this session, it's that given the dependence on agriculture and the fallout, we are building on our strategic partnerships to not only analyze, but to also come up with the collective response. Through our processes, we identified that USP had the capability, the reach, not only the reach within the Pacific, but the reach internationally, because they were linked up with UK universities. With respect to the technology, we also supported access to tablets, and you will hear more about that. And they were able to mobilize their student population and their faculty to also work at given their knowledge and their appreciation of the cultural context. Maikana was there. We helped build on it, and you will hear more from Atika Kama and her team. And we want us to we want all our partners to uh, uh, recognize the importance of relying and working with local partners. And this is one of the reasons why we have been able to reach so many communities through this partnership, building their capacity and helping not only and involving them in the assessments as well as crafting the solutions. So we think that this is the approach for agricultural transformation and sustainable development. We welcome you to this webinar, and we look forward to interesting discussions, high participation, and of course, some ideas on the way forward for the Pacific region. Thank you very much. Welcome on behalf of CTA, IFAD, and PIPSO, and all our partners who we've worked with across the region. Back to you, Pierre. The agenda, sorry. Well, I've done the welcome remarks. Pierre has his interesting way of engaging us. Then we'll have the presentation from Morgan and Villy, USP, but I think Villy will be the main presenter. We have some discussion, Q&A. Uh, then the home gardener nutrition for building community resilience will be presented by Ateka, director of the National Food and Nutrition Center in Fiji. We come back into our Q&A and plenary discussions, and then we will have our closing remarks by Tawfiq, if he's there, and if not, tomorrow from IFAD. And of course, our networking session, because we do believe.
Okay, I'm listening to the webinar this week.
Yeah, so thank you very much. We look forward to a very exciting deliberations. Thank you, ladies and gentlemen. Back to you, Pierre.
Thanks very much, Judith. Thanks a lot. Indeed, quite a rich and interesting program we've got today. If you were with us in previous webinars, you know how we're doing things. Everybody's behaving pretty well, keeping the microphone off. Especially it's important, the second point, use the chat. We use the chat a lot to interact and to have parallel conversation as the presentations unfold. Ian is our chat monitor, and also our presenters and speakers will engage with you in the chat. So as the presentations unfold, please log any question or comments that you have in the chat. Use it also, please, to report any technical issue that you might encounter. And remember that this webinar is being recorded for later playback. So again, if you were with us before, you know that we like to hear from participants before we hear from our speakers. So here's a quick poll that we would like to run for you or with you. We're talking about home garden today. So do you or any of your family have a home garden? I'm now launching the poll. You should see it in a second. And the poll is now open. Please vote. So do you or any of your member of your or any member of your family have a home garden? I have to admit, I try myself to grow veggies on the balcony, herbs more than veggies actually. I try also to grow some ginger and turmeric. But I think there is just too much sun on my balcony. And yeah, the results have not been really great so far, but I keep trying. I don't give up. So just a couple more seconds for this poll, and closing in 3, 2, 1. And this is really, really great. So you see 94% of you have already doing some home garden. You are already, you have an home garden. I don't know if it's you or your family. You could elaborate further in the chat. That would be great. So yeah, quite an active audience in terms of home gardening already. Let me stop this poll. We have a second one. And the poll is like this. So do you think that home gardening is a solution to addressing the negative impacts of COVID-19 on nutrition and income in the Pacific? I'm launching the poll now. And the poll is a simple yes or no, but we would like you to elaborate in the chat why yes and why not. So cast your vote and tell us in the chat why you think that home gardening could be a solution, or why not. I see the votes coming in. We got about 50% of attendees that have now voted. I don't see much activity in the chat yet, but please let us know why yes or why not. It's simple to say just yes or no, but can you elaborate? We want to hear more details. What do you think? Why do you think home gardening could be a solution or not? So 80% of attendees have voted now. Give ourselves 5 more seconds maybe. Let's see. So the poll closes in 3, 2, 1. Poll is closed. And now let's see the result. Probably not surprising, seeing that everybody is already doing home gardening. A huge majority, 94%, thinks that home gardening could be a solution. Jana, can we see some elaboration in the chat on the responses, on the why yes or why not? Is there some details there? Because I cannot see much details in the when I do screen sharing. It's a bit difficult to see the chat. So folks, don't be shy. Tell us why all of you think that home gardening could be a solution. Can be just, a couple of quick ideas. Yes, definitely.
Fresh.
Yeah. Fresh. I guess also healthier, right?
But additional effects on prices and overproduction need to be addressed.
Yeah. That starts to
be... increases availability and accessibility of food.
Yeah.
Growing your own food should be a solution to all at all the time, not only addressing disasters.
Yeah, as they say, another group I follow, they say plant your plate. So that's, I think it's in line with that.
Sorry. Yeah. It's also, someone is saying it's also a good way linking youth to food systems.
Yes, absolutely. All right, thanks very much, folks. This is really, really interesting. Let's keep this level of engagement throughout the webinar. I'm now going to stop the result, the poll. I see some people are still coming in. I'm going to exit screen sharing, and I would like to invite Billy to come on with audio, start sharing his screen, and guide us through his presentation. Billy, if you can unmute yourself, please, and start screen sharing. I hope you're timing yourself. I'll be timing you. You've got 20 minutes from the moment you start screen sharing. We still don't see your screen.
Can you hear me?
We can hear you all right. If you can start screen sharing, please, your presentation.
Okay. Can you see it now?
It's coming up. Yes, if you can go full screen.
Yeah.
Yeah, all right. Floor is yours. 20 minutes starting from now.
All right, Bula Benaka and Talo Falava, everyone. I'm Vili, as mentioned before, and I will share with you the results and the method and the activities that was carried out. For your information, this is a Pacific Island-led research collaboration, and I am presenting on behalf of the hardworking research team at the Pacific Center for Environment and Sustainable Development, both at Suva, Fiji and Solomon Islands campuses of the University of South Pacific. Also, I would like to begin by sincerely acknowledging the research partnership and collaboration with CTA, especially our amazing Judith Francis there and Jana, and also the International Fund for Agricultural Development, the IFAD, and also our local partners, Friend Fiji, especially Sashi Kiran, Custom Garden Association in the Solomon Islands, Peter Kia Tikai, and also the collaborators from the Fiji National Food and Nutritional Center, Chowalesi Tuiloma and Ater Kama. And I'm also very grateful to the communities in both Fiji and the Solomon Islands. Last but not the least, I think it's important to also mention the research partnership with Dr. Cornelia Quell and Dr. Emily Haynes from Exeter University, and also Professor Nigel Unwin from Exeter University and the University of Cambridge in the UK. So it's very important to mention that. And in this presentation today, I will briefly cover the background of the assessment and why we have conducted the assessment, and also building on the existing activities as mentioned by Judith earlier. And I will also talk about the method, the results, and share some lessons learned and the implications for our responses. There are many assessments. There have been many assessments done in Pacific Islands and are mostly at the national or regional scale. And they are mostly done through online mode because of COVID-19. For this research, I think it's an advantage to have the University of South Pacific as a partner, because we do have campuses in 12 Pacific Island countries, and there are researchers based in those campuses who can carry out the assessments on the ground, as you will see. Also, I think it's very important that it's crucial to have evidence of scale and intensity of impacts at household level and also the communities. And these evidence are needed in order to inform policy and program responses against COVID-19. And it is important as well to remember that this initiative this research is built on existing community food and health tools that will develop through the partnership under the Community Food and Health Project funded by the United Kingdom Research and Innovation Grant, or the Research Council grants. And it's also built on existing relationship, the research relationship that Judith mentioned earlier. So these relationships existed far before COVID-19, so it facilitated this research. The methods, I mentioned the CFAR tools. So I will share with you probably later, if you need to know more, the links to the CFAR tools, as well as some publications that were produced from the earlier partnerships. We updated the CFAR tools for the quantitative tool. The food components basically remain the same, except some changes of timeline from a year to 6 months before the interviews to capture the COVID-19 timeline. And this research was done in July, just last 2 months. And then the components of the food component looked at 24-hour recall and also diet screener, the food insecurity experience scale, food sources, and most importantly, the nutritional knowledge of our communities. We also added the 3 non-food components to capture the social impacts, the impacts on socio-economic and income, and also education and learning and health and water security, including coping mechanisms and needs of households. And some of the methods and the questions that we use were adopted from the World Food Programme Mobile Vulnerability Assessment Monitoring Tool and other COVID-19 impact surveys or assessments that were conducted in the UK, India, Africa, and the United States of America. And I think it's important as well to clarify that because of the nature of this session and also the limited time that I have, I will focus mainly on presenting the food component of the research, as we will release 2 reports probably by the end of next week or after. And then we set up these tools and we use tablets and the Copo Toolbox software carry out the field work on the ground. Also, we updated the qualitative tool, the focus group guide that we use, and we updated the tool by adding before and during COVID-19 timelines, and also non-food components such as education, health, and water security, as you can see this. And target group, we covered 9 peri-urban and rural communities across Fiji and the Solomon Islands, and we covered about 426 households. And these households were identified in very close partnership with Friend Fiji, for Fiji, Custom Garden Association in the Solomon Islands, and also the village leaders in some of the communities in Fiji. Now we go into the communities that we covered. So these are the background of the interviewees from Fiji. And you will see that the top 4 communities from the Central Division in Fiji. So Central Division is around where Suva is, and they did not work with Friend before. But these communities, we worked with them during the CFA assessments in 2018. And Kalampu is a formal village, but they are within the peri-urban area. Moani Koso is an informal settlement, and they are in the urban area. Molituva is a formal village in the rural, in Tailevu province in Fiji. And Vusuya is also an informal settlement at the rural area. The bottom 5 communities are at the western side of Fiji, and Friend worked with some of the households in these communities, and we covered them in the research that was conducted in partnership, as Judith mentioned earlier, in 2019. So for these studies, it included the households that was supported by Friend, as well as the others outside. And for the Western communities, Bila and Drasa Vivi, the settlements or the informal settlements in the West. It's quite interesting to note that there was very high coverage of households in the survey in the West. We covered about 63% of households who were interviewed using the quantitative tool. So we covered 4 focus groups in each community. So you can see the different numbers of the focus groups. We had adult male, adult female, youth, and also youth male and youth female in each of the communities. For Solomon Islands, the top 2 communities there are urban informal communities, Burns Creek, and Barana is peri-urban, but more of a formal community around the Honiara area. They have access to a lot of land. Ngalimbiu and Panatina are rural and formal communities. Custom Garden is supporting some of the households in Burns Creek and working as well with the other communities. So we covered about 12 or 13% of the households in the Solomon Islands, and the qualitative, the focus group discussions also covered the 4 different focus groups with different totals there, as you can see on your screen. Now we're going to look at seeing some results. So the first set of results I'm going to present is an impact on sources of income, looking at Fiji. But before I speak about this, it's important to note that employment or unemployment is defined in our research as able people who can work, or the number of people who can work but are not working or not helping out at all the household. So if you look at this graph in front of you, so on the top we have the work status before COVID-19. And then at the bottom graph is we have the main source of income and the work status during COVID-19. And there are 2 very important things here. First is that there is a reduction of unemployment. as you see from the green bar on the top compared to the bottom one, the able people, because of the lockdown, they return back to their communities. And then they are now becoming useful members of the community. They are involving in home garden and all the other activities at home. It's also important to know there is an increase in self-employment or being involved in farming activities or informal income generation activity, and there are a lot of employments by NGOs. In Fiji, the major impact is reduction of income for the households from sales and employment. So these are some of the details of the impacts on sources of income in Fiji. And COVID-19 has disrupted work and sources of household income in most of the households studied. You can see here that is so-called green. Naviango and Wakampuli households are mostly working for NGOs and companies that were less affected by the flights lockdown. I mean the closure of borders and things like that. So they answered no there. And most of households agree there are changes to the access to markets and jobs. The access has been reduced. And also most agree there is a reduction of purchases of food and non-food items before compared to like right now during COVID-19. Now we look at the impacts, sources of income in the Solomon Islands. It's also very similar to Fiji. There is also a reduction of the unemployment, especially in the rural area, as you see indicated by the arrows and the change of colors. They are on the top graph and the bottom graph. And there are also a lot of people who are self-employed, defined as people who are involving in farming activities and also involved in NGOs. So, yep, so it's very important to understand this, to know that even though the markets are down and are not active, the households level are still working on farming, not only for food, but they're hoping to a source of income. Bringing down the details, most households in the Solomon Islands agree that the total household income has been reduced, more severe in urban areas. You can see the two communities there, mainly due to the restrictions and the disruptions of markets, the movement restrictions. Urban households in this setting, they usually buy or purchase the produce from rural farmers, and then they go and sell them at the markets. But because of the lockdown, the rural farmers are not giving any more produce, and also the markets got closed down, so they got affected. The key sources of income are still farming and informal sales along the streets. Disruptions of markets led to the establishment of own markets very close to the communities. We have got some information from some of the communities because of the lockdown of the access to the main market. So they created their own markets just in front of the community. And it was very good. They got more money and easy access for women, because in this setting, the women usually go and sell the produce at the markets. But that was about 4 or 5 months ago. They are observing now that the purchase have been reduced. I think the purchase power is reducing. And also they have noticed because of, like everybody is producing the same vegetables. So there is no more demand for the produce. And these are some of 2 quotes, one from Fiji and one from Solomon Islands, just to share the feeling on the ground and the feeling of the impacts on our people. So the first one is from Fiji. It's very tough when they have to pay the utility bills and also manage the family expenses because of the impacts of reduced pay. And then the second one is from a farmer in the Solomon Islands. He sent his wife to the market, $10 to sell the cabbages. And they reduced the price even to $5, but they still couldn't sell them all. And it was very sad and heartbreaking for the farmer, because they still have to buy the to pay the transportation fee and things like that, and there's quite very increased food loss and food wastage on the ground at the moment. So before I continue, we have a poll question here. What are the top 3 foods are you producing and why? Pierre?
Yes, I've launched the poll just now. Thanks, Willy. So the majority of you said that you're doing home gardening, you're growing your own food. Here we provide some options. This is multiple option, so you can choose up to 3. So what are you producing and why? So again, make a choice or select some options and then complement your a response in the chat. That would be really great. So we learn more about what you're doing and why you're taking some actions. So we got about 43% of votes now. I would like to keep this fairly quick because really we're running a bit behind schedule. I know you like to push the boundaries of the time you got allocated. But that's all right. Let's give ourselves 5 more seconds for this poll. So to get to 80% of responses, and still people have that are coming in, which is good. I'm ending the poll now, and you should all be able to see the results. So veggies, I think, yeah, easy to grow, I guess. Anything that surprises you, Willy, here from the results that you see?
No surprise at all.
No surprise at all.
Very interesting, yeah.
All right, so yes, veggies at the top, followed by fruits and root crops at the same level, a bit of legume and pulses, not so much livestock, and 6% not growing anything yet, or anything of the above. Yeah, maybe something
Yeah.
else. All right, I'm gonna stop sharing the result and handing back over to you, Willy. Can we manage to get through the rest of your presentation in about 7 minutes?
Yeah, well, we can do that.
Let's try.
Okay, all right. So looking at the main sources of food on the ground, there is an increased reliance on food sources from the garden. This is from Fiji, plantation, river, and the sea. And there's also increased sharing of food and supporting each other. There's also a decrease in purchase from the local markets and also the convenience and the village shops. There is not much difference in the food sources between urban and rural households here in the central area of Fiji. But it's important to note that the informal settlements in central area do not have access to land. So they are much more disadvantaged here. From the western side of Fiji, they also use the same sources of income. There is a reduction of food from the shops as well as and the market, but there's also increase from home gardens. And these are the breakdown of the main sources of food from Fiji. There's a high number of households producing their own food, and there are also a high number of households who also purchase to supplement their diets. There's very little food aid. There's also very little sharing of food, but they do exist. Now breaking it further down to the food sources. So this is in line with your polling answers. There are quite a lot of people producing their own root crops, producing their own vegetables, and producing a lot of fruits and some fishing in the communities in Fiji. But there's very little production of plant-based and animal sources of proteins. And also fish is produced in 4 Western communities. So this is very interesting because it's in line with your answers. The main food sources in the Solomon Islands, these are the urban communities. There's an increased sources from the local gardens as well. Decreased purchase just like in Fiji, but it's good to note here Burns Creek with limited access to land doesn't have much diversity. sources compared to Parana here as well. These are the rural communities. They are inland communities, so they don't rely much on the sea. So it's important to know that there's decreased purchase as well from the shop and the main market. So the main food sources for Solomon Islands, just like showed in Fiji, is high reliance on local food sources and also the purchase. Is there no food aid and very little from sharing. The specific food sources from Solomon is also like Fiji and like yourself as well. A lot wide root crop production, processed other vegetables and also the fruits, but almost no production of eggs and other proteins or any more sources of food and pulses, cereals and grains. So looking at the types of food consumed, most households in Fiji, they consume fruits, quite a lot of fruits, and also an increased consumption of vegetables, 3 to 7 days per week. So this is very, very interesting for us to know that people are consuming what they are producing. Looking at the other sources of foods, the other types of food they're consuming, most consume fish, 1 to 2 days per week. But a lot of them may consume the canned fish or the tuna, tin tuna, 2 to 4 days. There is less consumption of unprocessed and processed red meats. For Solomon Islands, it's also the same trend as shown by Fiji. There is increased consumption of vegetables and also some fruits. And the pattern here for Solomon Islands, it's the same as in Fiji, but there's very high consumption of canned fish here in the Solomon Islands, as you can see. It's about 7 days a week. And the processed red meats are mainly consumed in rural communities, but it's also good to note there's quite a lot of I don't know answers here. They couldn't remember the last time they consume the processed meat and the unprocessed meat. This is our second poll question. Pia?
Yeah, we love polls, don't we? I think it's a great way to capture participant input and insight. So you can read the question. I'm launching the poll now. So do health experts recommend that you eat more, less, or same amount of fruit crops? This is only one answer possible, of course. So let's see. Let's see what the participants think. Let's give ourselves a few more seconds.
Your answer to this poll will depend, will determine which country you are from. I will allocate you into 2 countries at the end. All
right. Yeah, I see some interesting results coming up, Willy. So let's see if what we'll see at the end will surprise you or not. We got 70%. Let's give it a push to get to maybe 75%. So a few more seconds. Folks, cast your vote if you haven't done it yet. And we'll close the poll in 3, 2, 1. Poll is closed. Perfect. And you'll see the results now. So
that's very interesting.
But very close, eh? You see 38% less, and then 31 and 31 for more and same amount.
Yeah, we have a confused population here, Piero.
Or a very diverse one.
Yeah.
We also put it that way.
It's interesting because we will get back to this later on.
Thanks, Willy. And I see that there are some further comments in the chat, so please feel free to continue elaborating your replies in the chat and to continue the conversation in there. Stopping the results here, and again, over to you, Willy.
All right, so the implications of production and consumption for nutrition This is Dietary Diversity Score results from both Fiji and the Solomon Islands. These are the main Dietary Diversity Score. And then we look at Fiji. The households consume around 3 to 4 different food groups during the 2020 research. And you can see it's circled here. It's been reduced compared to 2019. The 2019 research was conducted in the Western communities in Fiji where friend work. And then 2018 was in the central communities in Fiji. And 2020 is both of the two communities. And then you look at also to the women for reproductive age. The DTS here is also declined 2020. Solomon Islands comparison 2020, 2019. There's a decrease in 2020 for both the households as well as women of reproductive age. National nutrition Fiji, it's important for us to know that there are also clear patterns here. There is a clear majority on knowledge of the need to eat more fruits, vegetables, and drink more water. You can tell that from the graphs. And there's also need to eat less processed food, sugar, and fast foods. That's very clear pattern for Fiji. But it's also clear that most households in Fiji have been recommended to consume less root crops that are locally produced and consume more whole grains that are imported. And this is displayed by the two circles here. So that's why I was interested. So if you say less root crops, then you are now a citizen of Fiji. Though there is a need to include this nutritional knowledge into interventions to promote the consumption of local foods. Solomon Islands, the same pattern as in Fiji, especially for what to eat more and also what to eat less. And it's very clear here. But in the Solomon Islands is a little bit the opposite of the recommendation for the root crops. They recommended to consume more root crops and less whole grains. It's important here as well where this arrow is that most households from Burns Creek are not sure about the health recommendation for processed foods. So this kind of information is important. And if you poll that you need to consume more root crops, then you are now a citizen of the Solomon Islands. So this is also the main important point here. So often we forget nutritional knowledge in the interventions, but this is very, very important for us going forth. Food insecurity at the household level, this is the percentage of total households. Now you can see there's more severe food insecurity in the Solomon Islands compared to Fiji. When they say mild food insecurity, it means that the household is uncertain regarding the ability to obtain food. So 40% of the total households in Fiji and 76 for Solomon Islands. When it comes to the upper level of moderate food insecurity, then we have here 36 for Fiji and 83% of total households for Solomon Islands. And this is about reducing food quantity and some households starting to skip meals. And then we look at the third one, severe food insecurity. That's when households, there's no food for a day or more. So interestingly here, because there is high consumption there's high production of local foods. And there is also high consumption of local food. But it's important to note as well that there are some households that are not producing that were covered in the research. So it's need to focus as well on those details. So these are some of the reflections from the focus group discussion. Solomon Islands, there were many occasions when our households does not have much to eat. And on one occasion, we were fed by other members of our community. And for Fiji, no matter how small of a portion of food we get, we will share it amongst ourselves at home. So these are some of the reflections about this. As mentioned, that I will not go into details of looking at the impacts on water, education, health, and in Fiji and Solomon Islands. But I just want to bring this information that access to clean water in Fiji is okay, except that there is frequent water issues, but those existed before COVID-19 in some areas of Fiji. But for Solomon Island, there have been recorded works from the communities that the movements of people back to the villages or the communities is increasing water insecurity, because now they have to line up to get water much longer, I think 3 or 4 hours compared to the 35 minutes they used before COVID-19. So it's very stressful for the community. So the matter here is that COVID-19 is increasing water insecurity, and it's adding on already worse situation on the ground, especially at urban areas. Education, when the schools got locked down, the children at home were not willing to learn. They played with their peers and just ran around. And the second one, it's quite hard to monitor the children and do farming and all the other chores at home, especially for women, and the lack of support for home learning. And children are not returning to school because of financial hardships. This is in the Solomon Islands. So I'm just saying this because apart from food, there are so many other stresses our households are going through. Apart from COVID-19, TC Harrold impacts, and so many other impacts there as well. So it's important to note that. But the reports will come, and you can access the details of those impacts. So to conclude, COVID-19 has reduced household income. That is very clear, and there are evidence of that in this presentation. Employment and markets are affected as well. Households have increased production and consumption of foods from gardens, especially root crops, vegetables, and fruits. But Dietary Diversity Score is decreasing, and diversity of crops, including pulses and livestock, fish, need to be improved to ensure families have well-balanced meals, and Dietary Diversity Score can be increased. And there is a need for a coordinated and systemic approach here to address food and non-food needs at household level. Also COVID-19 and non-COVID-19 impacts, to look at a much more holistic approach. And this is should be done in partnership with the local communities and civil societies and church-based organizations and those partners who are working directly with communities. And they should be involved in planning, implementing the responses as well. And it also shows that the community food and health tools and approaches is valuable in providing the evidence to informing policies, investments, decisions, and programs as well. And when we speak about the systemic approach here, it's important for us to look and consider as well the health of our limited soil resources, the fragile environment that we have, and have foresight and visionary in our activities to include seasonal forecasts, climatic projections, economic forecasts, and also looking at the pandemic and population and social dynamics. It's good to look at this whole picture in order to be relevant, sustainable, and always proactively addressing the COVID-19 and many other stresses. And I think to conclude, I would like to say that this is the opportunity to work together to build back better, or to continue our journey to resilience, but do it in a much more smarter, efficient, sustainable, and a much healthier way. So, vinaka vakalevu and faftai.
Thank you very much, Ville. Thanks a lot. Very interesting and rich presentation. I would like now to open the floor for some Q&A. I see that there is a question from Tofik. There might be some other question that I've missed, so I'll go back to Jana in a second. But there is a question from Tofik around the percentage of food insecurity the question reads, food insecurity percentage equals more than 100% when added together. Can you explain what the percentage means? So Willy, let's start with this, and in the meantime I would invite anybody that would like to ask a question to raise your hand, so we can go hear from you right after this. So Willy, would you like to answer this question? And maybe you can stop sharing the screen, so we will see everybody in the main room. Yeah, perfect, thanks. So you should also be able to see the question in the chat now.
Okay, I think that is an excellent question, Tafik, and it's really good to know that you here. I am starting to answer this, and I can see a lot of people from the team who could be able to contribute. Yes, so this is following the FAO methodology, and there were 8 questions that were given out to the households to answer. So the results of those 8 questions contributed to the total of the results of the percentage of the household that was shown. So each question is aligned to a different category.
You're breaking up a bit, Willy.
Food insecurity. So I say that. Can you hear me, Pierre? Okay.
Yep.
They are 40% of the total households who answered that question, and then they will ask the other 7 questions as well. So that's why it's more than 100%. It's not a total
Thanks.
there. But we have a lot of other nutritionists in the team who can contribute to that answer.
Thanks, Willy. Let's see if there are other questions from the participants. Feel free to, from the attendees, feel free to raise your hand or just open your mic and come in with your question. Short one. I'll go to you in a second, Jana. I would like to see if there is anybody in the room that would like to take the opportunity to ask a question to Willy. Please feel free to raise your hand or come in with voice, unmute yourself. I don't see anybody at the moment, so let's hear from you, Jana. I think you have some other questions lined up, right?
Yeah, so I got a question from one of the participants in Fiji, and the participant is asking, where was severe food insecurity recorded, in the Central or Western Division?
I think that is a very good question, both Central and also Western community, and especially in the urban communities in the Central.
And there was also a comment on that the Dietary Diversity Score for Fiji is a little bit difficult to compare, since different divisions were surveyed in different years. So how do you balance that?
Yeah, I agree that they were surveyed in different years. The same communities were surveyed in different years. It's not much of a comparison, 100% comparison, but it provides some form of indication, some form of baseline to compare the 2020 against. So at the moment, this is the best baseline we have. It's the one we had in 2018 and the one we did in 2019 and then now 2020. I totally agree. It's not 100% fair comparison because of the different differences, but it's the best information we have.
Thanks, Jana. Any more questions from?
Yeah, there was a question that came in earlier, and this on more of an opinion question. So, is the focus on home gardening, especially in urban and peri-urban areas, a step in the right direction towards enhancing food security given the high unemployment rate with a downturn in tourism and economic activity in the region?
Very interesting.
I think to answer that question, it's very interesting to know that everybody in this, about 90% of everybody in this Zoom, and also the results all agree that it's very important to have home gardens and promote home gardens in order to increase the consumption of locally produced food and reduce the reliance of purchased food, especially the reducing the limitation of money, as everybody commented in the beginning of this session. But I think it's also very important to do it right. It's not just a matter of doing a home garden for the sake of doing a home garden. You have to do it right. And the results have shown that. You can increase the diversity of the varieties in your home garden. There is a very good 9x9 farming home garden thing that friend Fiji is promoting, trying to diversify this and also diversify the species in the garden. That's what I think.
Thanks very much, Ville. Thanks a lot for your presentation and this additional information that you provided through this question, to these answers. I encourage folks to keep on asking questions as we go on, but I'd like now to move on to our next presenter, Atessa Kama, which we were just concluding this segment talking about home gardening. So I think that's a perfect bridge to our next presentation. So Atessa, if you would like to start sharing your screen, and Ville, please stay with us. Don't leave us. We want to hear more from you through the rest of the webinar. But over to you, Atessa, for your presentation now. And you've got 15 minutes. We're way behind our program, but yeah, let's give you the 15 minutes that we had planned for this presentation. Over to you.
And thank you for this opportunity. I have much pleasure in presenting the work on the MyKana app that started way back in 2017. And at the outset, I'd like to thank CTA for the funding opportunity that allowed both teams here at the Ministry of Health and at NFNC and also at USP to develop the app. As a background to this presentation, the initial MyKana app that had My Meals Only was launched in 2017, while the My Garden component was launched in January this year. Both launches were officiated by the Minister for Health and Medical Services. So the main focus of the MyKana app is to assist with ensuring food and nutrition security for Fijian households. COVID arrived later, but we've also used the opportunity to continue using this platform and as a response to COVID, particularly in the face of the current economic climate. And the long-term impact is to improve the overall nutrition and health of our population and also to reduce non-communicable diseases. There are two components of the MyKana app, which is very easy to download, both for Android and Apple phone users. And this slide shows the link to each of these. So these are the two components of the MyKana app, MyKana Meals and My Home Garden. So I'm presenting to you some features from the MyKana Meals on the next few slides. So the overview of the MyKana app presents the daily breakdown of nutrients according to each meal, eating trends established over a period of time, weight and waist size tracker. It even allows us to take photos of our meals. We can also create recipes and build our own meals here. The screenshot on the right shows these available features that we can use. This is the nutrient tracker that calculates the major nutrients consumed at each meal in terms of calories, carbohydrates, fat, and protein. The listings on the MyKana app consist of more than 6,000 food and beverages based on the Pacific Islands food composition table and the Australian food composition table, and classified under 9 major categories. The screenshot shows the 9 categories available on the MyKana app. The MyKana app has 20 recipes already built into it, and with a nutrient analysis of each recipe. We have plans to include additional recipes from the bank that we have here at the Nutrition Center. The next few slides will show some of the features from the My Home Garden component. So on this feature, users can write their journal and notes based on what crops they have planted, the date of planting, including photos at different stages, from germination to transplanting to harvesting and replanting. This feature is time-stamped, so it has the provisions for dates and time of the day of when an activity happened in the garden. Even harvest can be journalized as well on the MyKana app. So the screenshot on the left shows the list of current crops, while the one on the right shows the journal entry of tomato harvested. The major planting seasons in Fiji and in the Pacific also, I believe, are the hot and cool seasons. So this feature provides the information on what to plant during each season. So each crop has a list of planting steps to follow. Even if we novices who have not planted mbele or kumala at all in our lives, the MyKana app will show us how to. So the screenshot on the left shows the listing of crops that can be planted during the cool season, while the one on the right shows the planting steps for chilies, for example. So the MyKana app has shown us what to plant, when to plant, and how to plant. Having no land space is no longer a valid excuse. The MyKana app will show us how to use containers, empty packets, and drums, old pots and pans, even kitchen sinks and bathtubs. In fact, anything that can hold soil and moisture. And it also demonstrates the use of homemade fertilizers, how to prepare and apply them on plants and on the soil. So the screenshot on the left shows the different techniques of container gardening, while the one on the right shows how to mix compost and compost tea for homemade fertilizers. This screenshot features homemade pest control using materials that are readily available at home, how to mix oil with soap, and details each step of how to prepare and apply it. So in terms of community outreach, as mentioned previously, the main focus of the MyKana app is to ensure household food and nutrition security in peace times and even during disasters and emergencies. So we have been using the MyKana app to advocate for healthy eating and starting our home gardens even during and post-COVID. Through the MyKana app, we've seen enhanced collaborations between the government ministries mentioned here. We've also noted increasing requests from communities and organizations for training and workshops. So our team is continuing with follow-up visits with communities, gardens in health facilities, organizations, and even individual households who have been trained on the MyKana app. There's continuous postings on social media showcasing the progress of these gardens and empowering communities to sustain their gardens. So our team had also developed instructional videos to complement current training programs and training materials and information. These are some of the pictures from our community training and gardens. The top left shows soil mixing with compost. The two newly established gardens on the right and the bottom left shows cuttings of herbs and aromatic plants that is usually part of the training package presented to participants at the end of the training. On social media, both at NFNC and USP have dedicated social media channels. So this is used to promote and advocate for the MyKana app. Also the use of hashtags, MyKana Garden and MyKana Fiji, and USP regularly does paid promotions on Facebook. So the graph on the right shows the increasing number of likes during and post-COVID. So the outcomes and way forward as a conclusion to this presentation. This is some of the tangible outcomes that we've seen. Increase in MyKana usage with more than 5,000 downloads. More than 200 gardens have been established and sustained. There has been improvement in nutrition knowledge and dietary diversity. Testimonies from women and youths eating more homegrown vegetables and fruits. Likewise with savings made through a reduction in food expenditure and likewise increased income from selling by the roadside. And we've also seen a strengthened collaboration among government ministries and organizations and enhanced engagement with fellow professionals and staff empowerment, particularly with the dietitians and nutritionists in the Ministry of Health and Medical Services who have been using the MyKana app as a counseling tool to address food and nutrition insecurity, particularly with My Meals component. The expected impact is mentioned, informing policies, multi-stakeholder policies on food and nutrition security, and also ensuring household food and nutrition security and reduction and prevention of NCDs. So as a way forward for the MyKana app, this is what the team would like to see, that we gain more political buy-in to expand the reach and use of the MyKana app, scaling up within the region, supporting more face-to-face training and replicating lessons learned within the region. We'd also like to see a future collaboration with multiple stakeholders, helping other communities and households to establish more gardens and particularly sustaining them as well, especially in urban and semi-urban areas in Fiji and the other Pacific Island states. And also support our users to self-regulate dietary intake to meet daily recommended requirements. The response to the communities, we think, is very important in progressing forward. How do we respond to them? How do we help them? And the two main components in continually engaging with others, with fellow professionals to address food and nutrition security. So there is, we'd like to see the possibility of future strategic partnerships and collaboration between government, academia, and other organizations, and scaling up within the region. So this is our contact details, both NFNC on the left and my kind of project team at USP on the right. And apart from the main organizations listed here, I'd like to also thank our own team here at NFNC and the USP for the work that has been done so far and for the work that will continue on the MyKana app. Thank you for your attention. Binaka.
Thanks very much, Atessa. That's really, really interesting. I was completely sold. I tried to download it, but unfortunately it's not available in Malaysia. I even tried to use my VPN to connect through Australia to see if we could download it, but no luck yet. I'll try again. And hopefully that will improve my balcony gardening technique, results especially. But this is really fascinating. Thanks a lot. If you could stop sharing the screen, we go back to the main room. I see that there is some activity in the chat, and your colleague Irene, as well as Judith, have been answering some of the questions related especially to local and the traditional recipes and seeds. So I'm not going to go there. But I see there is a question related to partnership. You mentioned at the end of your presentation, and there is one specific question from, well, comment and a question from Florence about linkages with institutions working on biodiversity in the Pacific. So is there something that you're already working on? You're muted, Atessa, so if you can unmute yourself, please. So are you linking up with institutions working on biodiversity in the Pacific? That's the question.
So, sorry, well, what was that, Pierre?
The question is if there are linkages, if you are exploring linkages with institutions working on biodiversity in the region.
Not as yet, no, but we'd love to explore those networks with other institutions. Vili's presentation had mentioned the data on dietary diversity. And yes, we'd love to establish those linkages with institutions that have done work on this.
Thanks. You will see. You see that there is activity in the chat. So Florence just posted the link around the work that USP is doing on biodiversity-related matters. So I'll leave it there for you to follow up later. I would like
Andrea?
to see. Yes, that's Florence. Yes, please
yes,
come in.
It is from Rome. I was just, because we've been following for many, many years. I was working in FAO on food security and nutrition, and in particular indigenous foods. And there's been really very interesting work done in that part of the world in particular, not only for sustainable food system, but for healthy nutrition and fighting obesity. So I think it would be very interesting in linking with these kind of processes.
Thanks very much, Florence. That's really useful contribution. So we'll have the link in the chat. I'm sure that Atessa and Irene will pick it up later and get back for additional questions, if any. Any other comments or questions for the MyKana team here? Please feel free to come in with audio, just unmute yourself like Florence just did, or ask questions in the chat. Or I'm also looking at Tiana to see if there are questions that came in before the session via email for the MyKana team.
But, well, Florence had also the question, could you elaborate on the traditional recipes and indigenous varieties in the MyKana app?
The recipes that, the 20 recipes I mentioned is all Fiji-based, locally available food. But there is a new book by SPC that is already available. It has Pacific recipes. They have gleaned recipes from the region, within the Pacific region, and that is already available. But the ones on MyKana app right now, and the ones that we will include later, are Fiji-based.
Thanks, Ateka. Let's see if we have any more questions for the MyCana team. See activities in the chat, so that's great to complement the conversation. I don't see any more questions at the moment coming up, so I think I'm going to pause here a second. Yeah, please keep sharing the links and additional information through the chat. We'll harvest all the resources that you are posting and we'll share them back to the community. But I'm going to pause here and go over to Judith. Judith, we're running a bit behind, so it's 7:18, I guess, in Fiji. 3:18 here. So Judith, over to you.
Thank you very much, Pierre, and very interesting discussions. And we are seeing all the pockets of work because there is, I think, Eleanor from Rome, Florence from Rome, and then there's mention of the SPC work. And as part of the project, we had also commissioned USP to do a desk review and also consult with local traditional specialists on the nutritional and health benefits of the local foods and marine resources. So Yana has been sharing the link, and I know when I met with the MyCana team earlier this year, they were also linking up with that work. So there's a lot more to be done. In terms of the traditional recipes. We also had some publications by Friend because of all the work they were doing on the ground. So I think it is very interesting. This short session, this session which has now been shortened, is looking at the way forward for policies and programs and of course partnerships, etc. And one of the things that we wanted to do was to get feedback from Morgan, who has been in the background, to say what would be his two, we are only asking for two, he can do one, two take-home messages for policies and programs, just to get the ball rolling. And then we would ask Ateka the same question. And of course, what we would invite participants to do, since we are running out of time, is also to put in the chat, what would be your priority interventions that you would like to see being supported by government and development partners? Because the whole reason why CTA and IFAD agreed that we needed to do these COVID assessments was also to inform the food security cluster governments, etc., as to how we can help people. So I don't want to say communities. How can we help people really take charge and fight or minimize the negative impacts of COVID on their households and of course nutrition, socio-economic circumstances, etc. So Morgan, are you ready with your answer?
Well, thanks, Judith. Yes, having done this work as well as having gone through a number of surveys results that have been shared, like in the face of all disasters, there's always some positive outcomes. So what is transpiring before us in the presentation that we're listening to is there are more now, a lot of people growing their home garden, producing their own food for consumption. It may be seen as a reactionary practice due to the impact of COVID-19, but this is a positive outcome. And the most important issue here now is how do we ensure that this positive outcome is sustained in the long run, in the long term, to ensure that there is food security. At the same time, nutritional level is improved to address this burden of NGD within the Pacific. So that's a important finding, that we need some policy strategies around that, and how can stakeholders in this space can all collaborate and work together to ensure that we sustain this positive outcome of home gardening and expanding the diversity of food that are grown and improving the nutrition to address another important issue in the Pacific on NGDs. That's really my take-home message from this presentation this evening.
Thank you very much, Morgan. And you came back with a question. How can we? And maybe as you and your team finalize the report, what should we be doing? Atika?
I'd like to mention here about the works that ongoing works on the Fiji policy on food and nutrition security. When we started with the national and regional action plans in those meetings that had happened with CTA earlier on, so what we've done is encompass those action, the nutrition components from those action plans into the Fiji policy on food and nutrition security. That policy is almost entering the door to cabinet. So we are almost there. And so through that policy, we hope to establish possibility of establishing future strategic partnerships and collaboration between government and organizations. And the MyKana app is inclusive in that policy as a tool to advocate for food and nutrition security. So that would be number one. And number two is the MyKana app is geo-locked to Fiji. Although our counterparts from USP had mentioned that if you are in Australia, you are now able to download the MyKana app from yesterday. So that is available. And although the initial purpose is to improve household food and nutrition security for our populations in Fiji, we'd like to also see that the region benefit from this initiative. So scaling up within the region would be the second priority in terms of the MyKana app.
Thank you very much, Atika. So we see how the work that we have been doing is already feeding into policy, and the MyKana is being scaled up. So we see two direct responses for addressing not only COVID-19 but the broader nutrition issues. And Atika, when you were talking, I thought that you had already seen my short presentation for closing this session on policy and program interventions. And I don't see any other priority interventions identified in the chart. So I am going to quickly show this presentation and then turn over to Tawfiq El-Zabri for the closing remarks. Pierre, I don't know if you still wanted us to do a poll, but can I just do my presentation now?
Yeah, let's go ahead.
Okay, thanks.
Thanks, Judy. Enough polls for the day.
Thank you, Pierre. So when we started this project on leveraging the development of Pacific local food crops, we did the analysis, etc., and I think it has already been reconfirmed today that Pacific agri-food systems, nutrition systems, are in transition. So I'm not going to go back to all the statistics. Everything is already published, documented, we can share. So we came up with a mix of interventions to address these challenges. And I want us to focus on, because we said multi-sectoral, disciplinary cross partnerships across. So we have looked at building capacity of farmers and their organizations, making sure that people understand the value chain. So as we go forward, we need to keep building on this work. We looked at the issue of how do the SMEs who are adding value and tapping into local and export markets, how they can grow their businesses. And if we have to have a response to COVID-19 and the broader issue of nutrition and income, we saw this as strategic. We talked about scaling up nutrition programs at community level, and you also saw the value of these home gardens, the fishing ponds, really investing in producing diverse local foods and making sure it's affordable. We also see the importance of linking with the University of the South Pacific and their international partners, not only to do the assessments, but also to provide the evidence to inform the decision making. And as Ateka was summarizing, she talked about the national action plans, which were then integrated into the broader Fiji national policy. So I had just taken out the example of the Kiribati National Action Plan, and you would notice that the impact aims across our action plans, which are co-owned by the partners, is about increasing household dietary diversity and production and sale of fresh and processed local food crops and fish. So Yana has also shared the link. And then at a regional level, we talked about the need for policy and governance. We talked about the importance of research and product development, education and outreach, and you would see that it was also coming back again in the presentations from this morning. So conclusion and the way forward, and this is supported by the two interventions from Morgan and Antika, and we did not plan it. I did not, we knew that they had to speak. And we are saying that cross-sectoral, multi-stakeholder, multi-dimensional approaches are needed, and they also need to be well-funded. And we have sought to bring coherence, and we have supported promising initiatives, which we think going forward, everyone working together can build on. But it's just one step in a very long process. So I thank you very much for participating and for working with us across the 4 years. And I will yield to Tawfiq to bring the closing remarks.
Thanks, Judith. Let's see. Yeah, Tawfiq, I see you now. If you can please unmute yourself. Thank you.
Thank you. Thank you so much. Well, thank you. Firstly, I'd like to just thank everyone for the presentations and rich discussion. Can you hear me? You can hear me, yeah? Okay. And I will try to be quick. I realize it's late in Fiji. I'm in Rome and it's 9:30, so just starting our day, and it's late for everyone else in the other side of the world. So I suppose, I mean, in addition to thanking, I would just share briefly my some takeaways. And I'm very kind of embarrassed to do so because I'm not, you know, the participants here know so much better the Pacific than I. But given the level of work that has been done and IFAD's interest in it, I'd just like to share our takeaways, and I hope to hear back from you, whether through the chat or through email, or I think there's some minutes after this closing for exchange. So really being very glad to hear back from you about whether these are the right takeaways or any other advice or thoughts. As I say, you know much better than me, but I think what the presentations showed us is that incomes have dropped, and there have been market disruptions, also movement and so on, and these have affected nutrition. We can see that in the drop in the dietary diversity. They've also affected other important social elements like education because of lack of income. And we can see actually that the drop in Solomon Islands from this survey seems not as high as the drop from Fiji, even though the starting situation for Solomon Islands was worse. So I think that in a way reflects that the important impact, well, the fact that having a higher level of subsistence farming in Solomon Islands helped cushion the impact to some degree, the impact from incomes to some degree. Whereas in Fiji, the economy depends a lot on external revenue, and there has been a drop of income, and that has also impacted quite a bit on food expenditure. And now, what I think I also heard is that there's more labor available for agriculture because people are working less or going back to their villages, and there is availability of resources. And as we were informed in the MyCana app, you don't need a lot of land to do farming, and you can also do backyard farming. We also heard there was discussion about the importance of local indigenous foods, their advantages in terms of nutrition, but also in terms of their suitability for the cropping, the climate and weather and soils and so on. And so, I mean, it seems to me that backyard gardening is also a coping strategy for people who are losing jobs and incomes, and also even access to markets to some degree. And so it's a way to reduce expenditure. I think the question has been partially answered, but it's still to be answered about the long-term impact of COVID-19 on nutrition. So we can see from the very important study by USP, the quick impact on some communities. But the question is, will backyard gardening really be able over the long term to help to minimize the loss on nutrition from COVID-19? And I say that because also, you know, agriculture is hard work, and you know, people may grow a little bit for their needs, but if they are not able to sell, then you know, the urban populations and other populations who do not have sufficient dietary diversity would not have access. So I think you know, what we can see is that ICTs like MyCana, and last week we heard also from Traceability, they help increase productivity by sharing knowledge. They reduce costs, and they support market transactions. Community agriculture will play an important role in dealing with the nutrition issue now with COVID-19, and there has been discussion and investment in that under this program. Farmer organizations will play a very important role, I think. We didn't mention that, but I think that this was an important part of this program, that because farmer organizations help organize production and get things to markets. And finally, what came up several times is the importance of collaboration between different partners, both government and other. And so I think a lot of work has been done in these areas, but we can see that more is needed. That's my main takeaway. And I think because this, if I'm not wrong, Judith, Yana, this is the last webinar we're having under this program. So I think really I have to thank Judith and all the CTA team for all the hard work done. If I may take this opportunity to say that, and also all the participants in the program and in this webinar, but also many of you have participated in various activities under this program. And I think I'm really sad that this program is coming to an end at the end of September. I think it played a really important role, and I hope we can continue to build on it. And these webinars help us to share, and I hope we will continue sharing. I know that CTA has also planned how to hand over all the knowledge and all the assets from this program so that they can continue to be used in the Pacific. So really, I want to thank everyone, and thank Pierre also for organizing these so ably, and thank everyone for the participation. As I say, these are my initial takeaways, and we're really happy to continue the discussion. So thank you very much. Over.
Thank you very much, Tawfiq. You see people clapping virtually or on the video. Tamar as well. Well, now the floor, I think we just open the floor for networking and to continue the conversation in a more informal setting. So let me, we remain in the same setting, but let me just stop sharing the recording. Again, thanks very much. Thanks everybody.